The aging population, rising rates of chronic disease, longer life expectancies, and advances in public health and medical technology have all contributed to more individuals needing long-term care. And it's estimated that 7 out of 10 people will need it, but only about 7% of Washington residents actually have it. What happens more frequently is that older adults are forced to spend down their financial reserves to qualify for financial assistance through Medicaid to pay for their long-term care expenses. In order to address that problem and the increasing cost for long-term care being borne by the state by Medicaid, Washington passed a law in 2019 enacting a public long-term supports and services insurance program. It requires individuals to pay in over the course of their working lives and then become eligible for benefits when they retire. Joining me today to talk about the program, WA Cares Fund, otherwise known as WA Cares, and some important deadlines that are coming up for both employers and employees, is WA Cares Director, Dr. Ben Veghte, who will start with an overview of the program.
Thank you so much, Leslie, for inviting me to talk about this new program. And I will give a brief overview of the program and then we can get to your questions at the end. So I'll talk a little bit today about why we need a new approach to long-term care. What is the WA Cares Fund? Why is it good for Washington? How does it support Washington families? How does it work and how is it administered and overseen? And then we'll get to questions. We all have concerns about aging, whether it's about our own future or a family member or friend. The following two scenarios are familiar to many of us. Barb's mother is in her 80s and keeps falling at home. Now she's broken her arm. She lives alone and there is no family in town to help. Siobhan doesn't want to be a burden to her adult children. They have their own kids to care for. She's having trouble getting in and out of the tub and is afraid of falling. These are common concerns many of us face with our aging parents and as we ourselves age. I know myself, I visited my father a couple of weeks ago in his mountain cabin. He had an accident about a year ago where he fell down the stairs from the second floor to the first floor and was on his own for a couple of hours, had to go to the emergency room, and my siblings and I raced out there, but he nearly passed away from the accident. And that's a very common scenario that as people get older, they have a slip or a fall, they have a health incident of some kind, perhaps a diagnosis, and the need for care can strike quickly and be a crisis for families. And as people live longer, dementia is becoming more prevalent. People often have multiple chronic conditions and medications to take. Have you ever had similar concerns to either of these scenarios? Naomi is afraid her dad's dementia is getting worse. He put plasticware on the stove and nearly burned down his kitchen. He refuses to move to a facility or to hire help. Ruben's grandfather could really use medication reminders to keep on top of his insulin doses before he ends up in a crisis, and nutritious meal delivery to keep his blood pressure low. Worry about our parents or grandparents or our own health as we age is something we all need to cope with. And the need for long-term care doesn't always wait until we're older. Some people need care at younger ages. Calvin is a working age individual with a need for long-term care following an accident. He has spent most of his savings on medical care and worries he won't have enough to pay for help with everyday activities like getting ready for work so he can lead the life he wants to lead. He has family in his life, but they also work, and he doesn't want to cause stress in their lives. He is a young man and enjoys his independence. Long-term care is expensive and can overwhelm an individual's or family's finances. Let's take the example of Hakeem. He turned 50 last year, and after caring for his mom, he realized he needs long-term care insurance, but he can't afford it. It would cost him $2,700 a year. And what's important to keep in mind there is for private long-term care insurance, you owe that premium not just on an annual basis, you owe it until the day you die or need care. For example, if you're 80 years old and you've paid in since you were 50, you've been paying in for 30 years at maybe $2,000 or $2,700 a year. And it's a lot of money you've paid in, but maybe on a fixed income in retirement, you determine you can't afford that high premium anymore. You have a lot of other bills to pay, and so you stop paying in. Well, if you do that with your private insurance, you would lose the coverage. And if you need care 2 or 3 years down the road, if you get a diagnosis of Alzheimer's, or if you have a slip in the shower, and you get some chronic condition that requires long-term care, you would have lost your private insurance coverage because you stopped paying in. So effectively, with private long-term care insurance, you have to pay in until the day you die, or need care if that comes sooner. And so with the Watt Cares Fund, this is designed to be affordable by definition, because it's an insurance program that you pay into only while you're working, kind of like Social Security or Medicare hospital insurance. And so for the Watt Cares Fund, if you're 50 years old, you'll pay in for 15 years until, assuming you retire at 65, you pay in for 15 years while you're working, when you can afford to pay in. And then once you retire and you're on a fixed income, you wouldn't owe anything. If you were to opt out of the Watt Cares Fund and buy private insurance, and you're a 50-year-old, you would owe premiums for maybe 35 years on average, because the average life expectancy of people turning 65 today is 85. So you would owe premiums for 35 years rather than 15 years. So more than twice as long. And so not only do you have to consider what the premium costs you on an annual basis, but multiply that by the number of years you expect to live from the moment you start paying in. So that's an important consideration. When the need for care strikes, it doesn't just affect the individual who needs care, it also has a ripple effect for their family. According to AARP, 6 in 10 family caregivers report having experienced at least one impact or change to their employment situation as a result of caregiving, such as cutting back work hours, taking leave of absence, or receiving a warning about performance or attendance. So when I'm older, if I need care, if I don't have something like the Watt Cares Fund in place, my wife might have to quit her job to take care of me, compromising her retirement security. My son might have to move across the state or across the country to live closer to me, and he might have to drop off his career track and get another job on a different career track or at a lower position of seniority in order to be close to me to help me. And this is the impact that a long-term care has on families. Similarly, family caregivers, it also affects employers. So employers need their workers to show up to work rested, focused, and able to be productive, able to take on responsibility, able to take on promotions, able to take on leadership roles. And in the current system where most people don't have access, most people can't afford long-term care insurance, 93% of Washingtonians don't have it. Workers in the prime of their careers, typically women who tend to take on these roles, caregiving responsibilities more than men do, unfortunately. Women in the prime of their careers are often forced to turn down promotions or reduce their work hours because of their family caregiving responsibilities. So this is an issue. Long-term care affects not just you as an individual, it can affect your spouse, and it can affect employers as well. One final perspective to keep in mind here for employers is diversity, equity, and inclusion. A lot of employers are very concerned today about improving their performance around diversity, equity, and inclusion. For HR departments around the state, it's important to keep in mind that you make your workforce fully informed about a program like this so they can make decisions about what's best for them. A lot of times what's happening today is that HR is bringing in benefits brokers who are trying to sell a product to their employees, which is private coverage, and marketing against the public program in so doing. And it's important to invite in the people from the program itself to present to your staff and employees what this program is and what it could mean to them, so that they're getting balanced information. Because otherwise, what could happen is that a lot of your upper income employees could opt out of this program, leaving your lower and middle income employees in the program. When higher income people opt out of a program like this, it drives up premiums for everyone else. So from a diversity, equity, and inclusion perspective, it's important to keep in mind the equity effect that has. Next slide would be, here I wanted to cover the impact that this is, why this is such an important issue today. And Leslie touched on this at the outset. This is becoming more of an issue than it has ever been before for a variety of reasons. One of the big ones being that people are living longer, and because of the baby boom dynamic in our age pyramid, this blue line, those 85 and older, is going to increase significantly. In fact, the population 85 or older in Washington state is going to double over the next 15 years. And the population 75 to 84 is going to double over the next 20 years. So you can see that the issue that affects families, every family is affected by long-term care in some way, but that's also magnified across the state because more and more families are going to be affected. And that means that more and more employers are going to be affected by their employees in their 40s and 50s having to reduce their labor force participation in order to care for aging family members. And it means that the need for long-term care is growing. Over the last 2 years, long-term care expenditures made up 6.3% of the state budget, mostly for Medicaid long-term care. That's prior to COVID, not even taking into consideration the additional expenditures for COVID. With a doubling of the caseloads over the next 2 decades, that percentage of the budget going to long-term care could double, and that clearly wouldn't be sustainable. And so the state also needs a different approach to financing long-term care. The current approach where rich people can buy private long-term care insurance, only about 7% of people can afford that. Poor people have access to Medicaid, and middle-class people have to become impoverished as a result of long-term care and then apply for Medicaid. That's a system that doesn't work well for most families, and it doesn't work for the state budget either, because if the number of people applying for Medicaid doubles over the next 2 decades, it's going to be unsustainable for the state as well. It's important to keep in mind some data points about what people can afford. The median household income for retirees in Washington state is $56,000. So that means that, after taxes, a family a household, a husband and wife or 2 partners might just have $45,000 to live on. From that money, they have to pay for their mortgage or their rent. They have to pay for food. They have to pay for health expenses out of pocket that arise. Most people just don't have extra money to pay $2,700 a year for a private insurance premium every year for both members of the couple, or to pay out of pocket for long-term care if they aren't insured. So that's why a program like this is all the more important. So what is the WACARES Fund? It's a universal long-term care program that was enacted in 2019. It works much like Medicare hospital insurance in that it's an earned benefit. Only those who contribute are eligible. You pay in over your career a small premium out of each paycheck. And in return, when you're on a fixed income in retirement, in most cases, that's when people need care, you have access to this benefit. It's affordable by definition because it's a small percentage of your wages that you pay only while you're working. If you lose your job or you're laid off, you do not owe premiums during that period. If you take time out of the workforce to raise a child, you do not owe premiums during that period. And after retirement, you do not owe premiums. For private long-term care insurance, you owe premiums during all of those phases. And a lot of people lose their private coverage because they can't afford to continue payments of private insurance premiums during such phases. So that's important to keep in mind. It's got a lifetime benefit maximum of $36,500 in today's dollars. That will be adjusted for inflation over time. So in 30 years, that'll be closer to $50,000 or $60,000. Contributions begin in January of next year. Benefits begin in January of 2025. So this is a brief summary of the current way or old way that we finance long-term care and the new way through the WACARES Fund. The current way is that long-term care insurance is expensive and unaffordable for most. That is because of what is known as adverse selection, where people most likely to need insurance are the ones most likely to buy it. So the average age where people buy private long-term care insurance in the United States is 60. People wait till they're older because they don't think about aging until they're getting closer to that phase of their life. And the people who seek it out are the ones who think they're going to need it. And so you have a bad risk pool, and that drives premiums up. That's why premiums are $2,700 a year on average. And even though sometimes premiums are quoted at a lower price, they go up over time, typically as people age. And that is the current average is probably what you can expect to pay down the road. Today, we all have a fear of not being able to stay in our home as we age. I know that I worry about that. My mom had Parkinson's and she needed long-term care at home. She ultimately had to go to a nursing home. If she had had a program like the Walk Cares Fund, she could have stayed home for much longer and might have never had to go to a nursing home. A program like this can allow you to age in place. Today, we all worry about how this is going to impact the finances of our family. I worry if I need care, how is that going to affect my wife's retirement security? How is that going to affect my son's ability to earn money and have a career? Because is he going to sacrifice his career to take care of me and then be in a bad place after I pass away? I worry about that. And I worry about depleting my life savings, not being able to leave anything to my son, and ultimately having to apply for Medicaid. With the Walk Cares Fund, a lot of those issues are addressed. We have, for the first time in the history of this state, in the history of this country, long-term care insurance is affordable for everyone. We've solved the adverse selection problem by having a universal program, kind of like that's the same way that Medicare hospital insurance addresses this problem. By having everyone pay in, everyone's in the risk pool and it becomes more affordable for everyone. I have peace of mind, we all have peace of mind, that 20, 30 years from now, if I need care, something will be in place. My family will have money to work with to hire a home care aide, or this program also offers the ability to hire a family member and make a family member or a loved one a paid caregiver. So families would have a lot of flexibility. And in short, when a care need strikes, the family doesn't have to focus on money the way they do today, the way I had to when my mom needed care. Instead of focusing on money, the family can focus on spending time with their loved ones, enjoying the special moments that you have left with them, rather than scrambling to figure out how to pay for a home care aide. How does it work? Well, the contributions are about 0.5% of wages. For the typical worker who earns $52,000 a year, the contribution is $300 a year or $25 per month. The premiums go into a dedicated trust fund, and if you want to be exempted from the program, you can apply for an exemption by November 1st of this year, and then you would be permanently exempted from coverage. In order to be exempt, you would need to purchase private long-term care insurance by November 1st. What do employers need to know? The employers do not owe any matching contribution. They simply collect premiums from employees and remit them to the Employment Security Department the same way they do today for paid leave. So it is really just building out on the existing reporting structure that employers already do. If an employee has questions about the program, the employer is not responsible for being the information source or answering questions. Employers also do not have to process exemption requests. All of that goes through state agencies. So if employees want more information about the program, they can go to our website, walkcaresfund.wa.org or .wa.gov, excuse me, or they can also attend webinars. Every week we have webinars at noon that people can attend. If you go to our website at the Learn More section, you can get more information about those webinars. If an employee wants to apply for an exemption, they apply through our website starting October 1st. Exemption applications will be available. They can apply for an exemption. It will be processed quickly, and they would not have to participate in the program, and it would also not be eligible for benefits. Self-employed people may choose to opt in, and if they do so, they can do that. That process begins January 1st of next year. Vesting and eligibility. The way this works is much like Medicare, where you pay in for 10 years over the course of your career, and you're permanently vested for the program. If you've paid in 3 out of the last 6 years, you're temporarily vested. So if you're 61, say, and you work for 3 years, or 62, and you work for 3 years and then retire at 65, you would be eligible temporarily for another 3 years after you're retired. But if you wanted to be eligible permanently, you need to pay in for 10 years. One thing to keep in mind is that you only have to work quarter time to earn a vesting year. So after retirement from your main career job, if you do anything in retirement that earns money, whether it's helping a child out in their business or making kayak paddles and selling them on Etsy, or working for your church, or whatever you may choose to do part-time, if you work for a little bit over 1 day a week, you may have enough contributions to earn additional vesting years. So you can earn additional vesting years that way after retirement. It's also important to keep in mind that our oversight body, the LTSS Trust Commission, is looking at ways to make it easier for people close to retirement to vest. So they may make recommendations to the legislature this year on ways to make it easier for everyone who wants to vest to pay in for a few extra years if they want to and reach 10 years and be vested. As I mentioned, the benefit is flexible. You can spend it on any combination of long-term care services and supports you want, as long as it's truly long-term care and the state is contracted with the provider. You can hire a home care aide, which most people will choose to do. That will allow you to stay in your home much longer. For many people, that will allow you to never have to leave your home and to stay in your home until the day you die. Some people will need more care, in which case they'll exhaust their benefit, and for them, Medicaid will still be there as a backstop to pay for any additional care they may need, whether at home or in a nursing home. To qualify for Medicaid, though, you have to have low income and assets, so you would have to meet those criteria. This program is a cross-agency initiative. DSHS is the lead agency in that we administer the benefits, we process claims. The Employment Security Department collects premiums from employers, much like they do now for paid leave. The Healthcare Authority has the system through which providers of long-term care can bill the state and get reimbursed for their services. And the state actuary monitors our finances and reports out to the legislature every year on how we're doing to make sure that we're on track to pay benefits over the long term. So that's the overview of the program. If you want to learn more, you can go to our website, wcaresfund.wa.gov, or email us at wcaresfund@dshs.wa.gov.
Thanks, Ben. As you mentioned, employees can apply for an exemption by signing up online by November 1st. How hard is it to do that?
Sure. If someone wants to be exempted, they need to have private insurance in place by November 1st. And once they have their private insurance in place, then they can apply for an exemption through our website. That is, the private long-term care insurance companies manage their own business, and I can't really comment on how easy or difficult they make it for people to buy their product. I know that one of the reasons why the Watt Cares Fund was created was because private long-term care insurance companies are in the business of trying to cover people who are least likely to need care. That is the business model of insurance. And so they do require blood tests and physicals and so forth to try to determine what your risk is. And then the premium is based on your risk level. So if you have a pre-existing condition, you may not even be covered at all. And if you if you're a woman, you pay I believe about 50% more than a man does because women live longer. There are a lot of factors like that that affect how a private long-term care insurance company deals with the application process. I know that there is a concern among the companies now that because there is this window for exemptions, that private insurance brokers are trying to aggressively sell policies and market policies to people. And the insurance companies are worried that a lot of people may buy a policy and only keep it for a year just for the purpose of opting out of the public program. And so the insurance carriers, many of them have pulled out of the market until November 1st because they want this exemption period to be over before they start selling policies again, because they're only interested in selling policies for the long term, not to people who want to buy for a year and then drop it. So many companies have pulled out of the market for that reason.
And just to be clear, if there is an exemption filed, that is irrevocable. So
that's correct.
Right. So once you file for an exemption, you cannot ever go back to paying into the program.
That's correct. And for the vast majority of people, this program is a great deal financially. If you do the math, if you make $50,000, you owe $300 a year. If you pay that in for, say, 20 years, if you're 45 today, that's $6,000 of contributions. So, and it's a $36,000 benefit. It's really more like a $50,000 or $60,000 benefit if you're 40 today, because it goes up with inflation, and it goes up more than your wages, because once you retire and your wages and you've finished paying in, the Watt Cares benefit still keeps going up for inflation. So if you need it when you're 85, that benefit will be worth a lot more than it is today, or that it was when you're 65. So even if you make $100,000, or even if you make $200,000 a year and you're 40 years old, you're still better off. It's still a great deal for you. So I encourage people to do their math on this.
How can someone who is self-employed be a part of the program?
Self-employed people can opt in starting in January of next year. So if you want to do that, just go to the whatcaresfund.wa.gov website under self-employed, and there'll be a process there that you can click on to sign up. And then you would simply pay in about 0.5% of your net earnings, and that would earn you a vesting year for each year you did that. And if you get to 3 years, you'd be temporarily vested. And if you pay in for 10 years, you'd be permanently vested in the program.
So you mentioned that the lifetime benefit is $36,500. And there are some who would say that, if I started paying in when I start working at age of 20, and I'm going to pay in for the entire duration, that if I were a judicious saver, I could make more than that $36,500. What is your response to that?
Well, I would say if that were realistic, then it would be happening today, right? I mean, that's the status quo. People are free to do that today, and no one does that, right? I mean, I don't know of anyone who does that for long-term care purposes and has a special account they set up for that, right? And so people might save for retirement, but half of households, the median retirement savings of families approaching retirement is $4,200. So that's a pittance. It barely is enough to get you an extra, $10 a month to supplement your Social Security throughout your retirement. If you turn that into that $4,200 into an annuity, it's probably like $10 a month, right? So people just aren't able to save. People struggle to save for retirement, much less for this. And the other aspect of this is that this is insurance. So what insurance does is, as you know, is pool risk so that, not all of us will need long-term care. 7 in 10 of us will. It's kind of like, health insurance or fire insurance or unemployment insurance or workers' comp. For all of those things, you don't know for sure if you're going to need it. It wouldn't make sense to save individually for all of those things. And most of us won't be able to save $36,500 for this anyway. But if you pay in maybe $6,000 or $7,000 over your career into this program, because not everyone is going to need it, the math works out to make a benefit available for $36,500 to people, to everyone. So because not everyone needs it, if you pool resources, you're able to guarantee a high benefit at a lower contribution rate. And that's how insurance works. And we leverage that magic of insurance, if you will, here to have an affordable program. The other thing that makes this affordable is that because we're not filtering out people based on their pre-existing conditions, we don't have any underwriting expenses. So private long-term care insurance companies have to do underwriting because in order to make money, you have to make sure you're not insuring people who are too high risk, or if they are high risk, you have to charge them a correspondingly high premium, because if you don't do that, you're going to lose money on those people. And so, but with the social insurance approach like Medicare or like this, we have a universal risk pool. So we don't have to do blood tests on people or have you get a physical to us. So we don't, all of the staff that private insurance companies have to pay to do all of that underwriting, we don't have to do that. So we save a lot of money on the cost side because we don't have to filter out people who are high risk.
There is one really important requirement, though, and that is that you have to be a resident of the state. And that has a couple of implications, both for individuals who may start here and relocate or decide that they want to retire elsewhere. And so I just wonder about that issue as well.
That's a great question, Leslie. And that's something that we're very aware of and we're working on. So we have an oversight body called the Ltss Trust Commission that is looking into ways to make it easier for people who are in that situation. For example, people who live in Oregon or Idaho, if they work in Washington State, they're subject to our laws, and part of the laws is this program. For the paid leave program, that makes sense because people pay in, and then if they need the benefit, they can get a check. This is a service benefit provided after you retire, and it's based on where you live. When you need in-home care, you need it in your home, and if your home is not in Washington State, then you can't get the care because the statute requires you to be in Washington to get the care. The reason that is because there's a lot of logistical work that needs to be done for us to cover people in other states. We have to do background checks on their providers. We have to make sure that the providers don't have a criminal record of elder abuse. We have to develop ways for every provider in those states to be able to bill the healthcare authority, and all of those mechanisms aren't in place yet. So we have our oversight body, the commission, which is looking into all of these issues. And I think those issues could be addressed either in recommendations they make this year or in subsequent years to the legislature. I can't get ahead of that process, but I do know that is being worked on.
Are there some general misconceptions about the program that you haven't touched on yet?
Sure.
In terms of the public's understanding of it, it seems like it might be a bit complicated to try to get the message out. I just wonder if there are some misunderstandings about it.
Sure. Thank you. That's a great question. I think there are a couple. The most basic one is that many of us think we're never going to get old. That's a misconception. We are going to get old.
I agree.
Right. And so I think I never thought I was going to get old and when I was in my 20s or 30s. And now I'm 54 and I'm starting to realize, it's already happening. And if I'm fortunate, I'll be 85 one day. Another thing to keep the misconception is that people think they won't need long-term care, but the data show that 7 in 10 of us do need it or will need it. I think a further misconception is that, well, if I need care, I can handle it. But my dad was upper middle class person. When he fell down the stairs, and passed out, he wasn't able to handle it on his own. He just wasn't. And I think it's hard for us to imagine that if we're fully functioning, healthy people in our 40s or 50s, it's hard to imagine what it's like to be, having fallen in your shower or be at the bottom of a staircase. And, it's like Mike Tyson said, everyone has a plan until they get punched in the mouth. And life can punch you in the mouth sometimes. And insurance is there for those times when you are on your back and it's a difficult situation. So when you're in this, and I think another misconception is that when we're in that situation, that it only affects us. So if I don't plan, well, then I'm responsible ultimately, and that's my fault, and I'll deal with it. Well, that's not true either. When my dad fell, my sister, my brother, and I, we all rushed out there. It affected us. It affected our work. It affected our careers. It affects our finances. And because we love him, if he really needed care and became serious, one of us would probably move out there to be near him. And so it affects your family in ways that most of us don't even think of. And I think the final thing to keep in mind is that this is, if you do the math, like don't trust someone else to do the math for you, someone who's trying to sell you a product. Do your own math, because if you do the math, even if you make $150,000, $200,000, for the vast majority of people, even if you make that much money, this is still a great deal for you because we don't have the expenses that private companies have. We don't have underwriting. We don't have claims adjusters whose job it is to try to not pay too many claims. We don't have profit. We don't have high salaries. We don't pay expensive lobbyists. We have a lot of expenses that private companies have. We don't have. And so as a result, we're able to offer a much lower cost program for the same, a much better value in terms of cost benefit than a private insurance company is able to offer. One more thing, Ltss, I think it's important to mention is that our vision for this and the legislature's vision is that over time, a supplemental wraparound Medigap style market will emerge. We're going to be working with private insurers to design supplemental coverage. So ideally for most middle-class people, if you want more coverage than 36.5, you'll be able to buy a supplemental policy that takes the Walk Cares Fund benefit as a deductible and just prices coverage above that. So hopefully there'll be affordable supplemental policies available in a few years where you pay into this, but then you can buy that supplementary. And that should be a lot better deal for people than opting out and buying a full-fledged private policy today, which can cost well north of $2,000 a year.
As you mentioned, WCARES is a joint effort of the Washington State Healthcare Authority, the Washington State Department of Social and Health Services, and the Washington State Department of Employment Security. Turning now to employers, they are going to start collecting WCARES payments from all W-2 employees starting on January 1st. Can you talk a little bit about that process and what outreach efforts are being made to help inform employers about these requirements?
Sure. The Employment Security Department is working hard. They've developed systems for rolling this out, and they're ready to go on that. They've created an employer toolkit, which is on our website, walkcaresfund.wa.gov. If you go on the employers landing page, there is an employer toolkit that you can download that will give employers everything they need to know in this regard. Essentially, it's just going to build on the existing paid leave reporting requirement and add additional premium that gets reported as part of that. But it should not be. I think introducing paid leave was a much bigger burden because it was a new program with a new set of reporting requirements. I think this piggybacks off of that to a large extent.
And what is the most common complaint that you're hearing from employers now?
I think because there is this window for exemptions, private insurance brokers are, sending marketing materials or pitching employees and pitching individuals across the state to try to sell their product. And I don't, blame them for that. My father was an insurance salesperson, so that's how he earned his living as well. And they certainly are doing what they should be doing for their businesses. But as a result of that, a lot of employees have been scared because the marketing materials portray the What Cares Fund as somehow not sufficient or problematic. And a lot of that information is simply one-sided because it's designed to sell people on the products that they're selling. So employers are expressing concern that their employees have questions. So I would encourage people to just come to our website, get the information from us, attend our webinars every week. We have a webinar one day a week at noon. You can check on the Learn More page of our website to find when those are, and learn the information, or you can email us directly at our website at our email address, and we will answer your questions.
There has been some criticism, especially from some lawmakers that have voiced their opposition to the program, and there may well be some action in the next legislative session. I wonder if you've heard anything or if you're expecting anything in particular coming up.
Sure. No new program is ever perfect out of the gate. There are always tweaks to it. Social Security and Medicare were both tweaked in the years after they were enacted. Paid leave has been tweaked. I'm sure this will be tweaked as well. There were some changes during the last session. I'm sure there'll be further improvements. It's important to keep in mind that there is an oversight body called the Ltss Trust Commission, which is tasked with looking at the feedback from the public, looking at our actuarial data, and monitoring implementation, and then making recommendations every year to the legislature on ways to improve the program. So they're going to be going through that process this year. They're going to make recommendations, and the legislature will do its due diligence and look at any ways that the program can be improved. That's one of the great benefits of a public program like this, is that it can be improved based on feedback from voters. And I'm sure that they're going to do that over the coming years.
Great. While WellCares is the first of its kind in this country, it's actually been around since 1968 when it was adopted in the Netherlands, and then later in Germany, Japan, South Korea. And there are several other states that are considering adopting a similar program, like California, Minnesota, Illinois, Michigan, Maine, and Vermont. How important is the success of WellCares here to those other states that are looking really hard at this idea?
Sure. It's very important because the age wave is hitting not just Washington State, it's hitting states across the country. And what that means is that for families across the country, it's already a crisis for families when someone needs long-term care. When my dad needed it, when my mom needed it, it was a crisis for our family. But that crisis is going to be magnified manyfold because of the age wave, and more families are going to be affected by this, which means more and more employers are going to be infected by the fact that their prime age workers have to leave the workforce to care for their aging parents. And it's because of income inequality, more and more households have to have all adults working and can't afford a stay-at-home caregiver. And so it's just going to affect our economy and affect families more and more. And so if our program here can succeed, hopefully other states can learn from that. This is just an area of what's known as market failure. It's an area that the free market hasn't been able to address. There's been 40 years of attempts by the private insurance market to address the needs of the middle class in this area. And they've never been able to get beyond 7% market share, just for the reasons I mentioned at the outset, that it's an expensive product with adverse selection and so forth. And so a broad approach that meets the needs of the broad middle class is desperately needed, not only in Washington State, but around the country. So we're doing everything we can to make this succeed here.
Are there particular lessons that you would just after having, witnessed the last 3 years since the law was passed in 2019, a definite list of here's what we would certainly recommend and here's what we would suggest you stay away from?
Sure. I think having strong communications at the outset before, but at the very beginning of the program would be helpful so that people know what this program is. Ideally, not having any kind of exemption at all is a best practice in social insurance programs. Medicare did not have an exemption or an opt-out. Everyone was in, and when you have a universal risk pool, it makes it easier because everyone's in the same boat. Everyone feels like that's fair. When you have an exemption or opt-out period, what you do is create a financial incentive for the insurance industry to market to people, to try to cherry pick people out of the program. And that creates a lot of negativity. And that's why there's been so much negativity this summer. And that's unfortunate. It didn't happen with the Medicare rollout. And as a result, that program rolled out much more smoothly. But if you do have an exemption period of some kind, then you have to also balance that with public communication so that people are hearing objective information about what the program is and not just hearing marketing information when they're trying to be sold a product.
Thank you, Dr. Veghte, for taking the time to speak with me today.
Thank you so much for having me.
Both consumers and employers can find out more about WACARES at wacaresfund.gov. All right.
All right, we did it.
Thank you so much.
You're so professional at this. I guess this is what you do for a living?